The incidence of type 2 diabetes is on the rise. We all know that diabetes is a disease that can affect every part of the body. But in the United States, did you know that over 100 million people have diabetes or they are pre-diabetic? Do you have diabetes? Or do you know someone with diabetes?
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Welcome back to Get Healthy with Dr. Cooper. Our topic today is defeating diabetes and its complications. Now, I'm sure you have heard about diabetes. There's so many people today with diabetes. There's a lot of information on the market, but what can you believe? Today in the studio, I have two gentlemen from my office. One who works in the lab, the other one works directly with the patient, taking their history and doing their evaluation. So they're here to bring the story home to you, the viewers. Guys, welcome Jesus and welcome Carlos. All right, guys, come on, walk up as though you have some life here. Hello, guys, how are you doing? Let's have a seat.
Thank you, doctor.
We're going to talk a little bit about diabetes. Now, Jesus, you have been in South Texas for how long?
For about 7 years.
7 years, and you're working directly with patients, correct? Carlos?
I've been here for about 10 years, more or less.
Right. And you see a lot of patients with diabetes, am I right?
Yes, a lot, patient.
Right. So, Jesus, when you see the patient, can you tell me what are the number one concerns of those patients? What are they concerned about? What they talk about? What's their fear?
If they're diabetics, what is my sugar level?
Right. What's the sugar level?
Yes.
And when you test the sugar level and you tell them, what's the reaction?
They're scared.
They're scared.
Yes.
Right. So we know that to be diabetic, then the fasting blood sugar needs to be 126 and above, right? Mm-hmm. And there's a range in between being diabetic and normal. So the normal blood sugar is about 70 to 100. And then between 101 to 125, we call that pre-diabetes. And a lot of patients don't like to be in this range. They get very anxious, right?
Exactly. We have one test that's hemoglobin A1C. That's it helps to get the accurate measure of
the average measure of the sugar over the last 3 months.
Exactly,
right.
3 months of.
Right. And then what is the range you like to see the patient at? Less than 7 or so, more or less?
Yes, it should be. We have a range, normal ranges. It goes from 3 to 8. Above 8, we consider a patient
abnormal.
Abnormal.
Yeah, but that's a wide range.
Yes.
For the normal patient, we want to see them below a 5.6.
Yes.
Now,
yes.
if they're 5.7 to 6.4, we call that pre-diabetes.
Yes, that's correct.
If the A1C is above 6.5, then at that time, they are already diabetic. So we use 2 levels to diagnose diabetes. We use the A1C, hemoglobin A1C, or the fasting blood sugar. Now, there's some patients that come to the office after they've eaten, right? And we'll check their blood sugar, and the blood sugar is high.
Yes.
But the normal range for the blood sugar after meal, 2 hours, could be up to 140. Now, if they're 140 to 199, then they're already pre-diabetic. If they're over 200, then they're diabetic.
Yes, that's
right?
correct.
So, Jesus, do they complain of other problems to you? Maybe pain somewhere?
Yes.
What are some of the complications? Because we're talking about complications today.
Yes, a lot of pain in their lower extremities, loss of sensation.
That's true. Swelling, tingling, burning sensation, right?
edema, or sometimes severe loss of sensation. They don't even realize they have an ulcer.
That's right. And that is critical. If the patient doesn't know he has an ulcer, it means that that patient has already diabetic neuropathy, and that is dangerous. So there are certain tests that you do in the office. Let's just talk about the tests you do on a routine basis for this patient. What are some of the tests that you do?
Some of the tests we do on our diabetic patient, it's an ABI, which is called an ankle
Brachial index.
to check for circulation of their arteries of the lower extremities. And also for neuropathy, we do our pseudoscan.
Right, checking for neuropathy.
Exactly. To see at what level are they at.
Right. What about EKG? Do you do that on a routine basis in the office?
Yes.
Maybe once a year at least?
Once a year or every 6 months.
Right. Or if they're having chest pain.
Exactly. Palpitation, shortness of breath.
Right. But did you know that diabetic could have a heart attack without having pain? So diabetes really can be a silent killer. There are patients who have had diabetes for years and they don't know they have the problem until they come in with maybe kidney failure, they're short of breath, and that's when they're coming into the office. Carlos, what are the other tests you do? Do you do tests to check for the kidney function?
Yes, of course. We do the on the basic metabolic panel. So in that panel, we check for the kidneys function with the BUN and the creatinine. So
and you also do the protein in the urine.
protein, yeah, exactly.
Because if the
protein in
patient
urine.
now has protein in the urine, it might be indicated that they do have
a kidney-
complications
yes, kidney
already.
failure.
Right. Now, in your mind, do you think we have a lot of patients with diabetes and their complication here in South Texas?
Yes, we do.
We do. We have a lot of patients with diabetes. Why? Because obesity is one of the #1 risk factor for type 2 diabetes. So if the patient is overweight, what happens is that the insulin doesn't function well, and therefore the insulin cannot take the sugar from the blood into the cells.
Yes.
And in South Texas here, we're probably the #1 in terms of obesity in the United
Yes,
States.
that's sad, doctor. That's
Now,
super sad.
do you also see children? Because remember, we're talking about type 2 diabetes, but the incidence of type 2 diabetes is on the rise in children. Do you see some children sometime in the office, guys, with,
Yes.
yes,
We've seen a couple,
a
16
couple.
years old,
14,
things like that,
16, 18,
yes.
20.
And their mom's questions are usually, is it reversible? Is it diabetes reversible?
Right.
Can my son be cured or my daughter be cured?
Right, that's on their mind. And as you know, we have had patients who have reversed their diabetes. You know, we have a gentleman, I can't give you his name, 25 years old, who came in with his sugar about 400, his weight was about 400, and after being on a healthy diet and exercise, this gentleman improved significantly.
Yes, wow.
So guys, you guys are doing a wonderful job, because I'm not the only one educating the patients, right, Jesus? You have to educate the patients too, and you, Carlos,
Yes, of
right?
course, yes.
All right, don't go away. I'll be right back with more information on defeating diabetes and its complications. Hi, I'm Dr. Cooper Dockery. Did you know that prevention of diseases is the gold standard to keeping you healthy? But early detection is also vital. So why don't you call your doctor today for an evaluation? Welcome back to Get Healthy with Dr. Cooper. Today our topic is defeating diabetes and its complications. I know that there are millions of people living in the United States and around the world with this disease. How do you get rid of it? And how do you get rid of your complications if you have diabetes? Well, let us look at some of the complications. I have Carlos and Jesus here with me. They work closely with the patients with diabetes, and that is why they're here. We're talking a little bit, very informally, about the complications. Now, we know that one of the main complications of diabetes is blindness, diabetic retinopathy, and cataract. Jesus, you do see the patients with these eye problem, right?
Yes.
How often do you send them to the ophthalmologist?
It's yearly.
At least once a year. Because the ophthalmologist will dilate the pupil and look in the back of the eye. Because diabetes can cause damage to the vessels in the eye, cause bleeding, and then can also cause opacification of the lens, and that is called cataract. All right? So we have to make sure that these patients are referred. Let's see if we have any picture here to show us anything about the eye. Alrighty. So here we have this picture here. You can see here, this probably is showing a cataract. The pupil here will become whitish. The lens behind there, it's white, and then the patient doesn't see well. And therefore, many times, this needs to be removed, a new one is in place, and patients see well, right? And then we have bleeding in the eye, what we call diabetic retinopathy. So if you have diabetes, make sure you ask your doctor to send you to see the eye doctor at least
Yearly.
once a
Once a
year.
year.
We are going to look at probably the heart. The heart is a very important organ. And diabetes is one of the main diseases to affect the heart. Jesus, do you see patients coming with chest pain sometimes?
Yes.
Yes, or probably after a bypass?
Yes.
Yes. So therefore, we have small vessels here. Right here, you can see this vessel. This muscle, the heart, needs to be fed. It's fed with blood. Now, if the patient has diabetes, then the risk of high cholesterol is there. These vessels can be blocked off and not enough blood get to the muscles, and then that will give chest pain. And the muscle here could die. If the muscle die, then it will become scar tissue. The scar tissue doesn't contract, right, Jesus?
Exactly.
And then the patients could have dilation of the heart doesn't function well, and they come with what? Shortness of breath, swelling. When you do the x-ray, you might have fluid in the lungs, and that means that this is not working well. So then we need to take care of the diabetes so that doesn't happen. Let's look at other complications. What else do we have? All right, kidneys. We're not going to look at this one. Let's look. The kidneys. Diabetes can also affect the kidneys. Jesus, do you see patients coming with problems with the kidneys?
Yes, we do.
They're on dialysis. Right, and then when you check them in the lab, Carlos, what are we looking for?
We're looking for the BUN. That's BUN and creatinine.
And the creatinine.
And the creatinine, yes.
That will give, and also the glomerular filtration
GFR,
rate,
right.
the GFR.
Yes.
It will tell us how well the kidneys are functioning. There's one more test that you've forgotten that we check in the urine.
The protein,
In the urine.
Yes,
there you
that's
go.
correct.
That's the first test. If that is high, it's indicating that the kidneys are in trouble.
Yes.
So guys, if you are diabetic, make sure you ask your doctor to check on your kidney function and check the protein in the urine. Patients who are diabetic have a high risk of what we call fatty liver disease. Here we have a beautiful liver,
Healthy.
nice, healthy looking, shiny and red. And what do you see over here?
Yellowish.
It's yellowish, it's filled with
It's
fat.
fat.
This is fatty liver, meaning therefore that the patient has a lot of fatty deposit in the liver. Patients who are type 2 diabetic usually, 90% of the time they're overweight. So there's fat all over the place. The fat is going to cause inflammation and scarring and liver cirrhosis. Then when they get the liver cirrhosis, what happened? They're very sick. They have
Yes.
swelling. They have ascites, right? And the liver cirrhosis can lead to liver failure as well as cancer, right? So I know in the lab you're going to check for liver function test,
Yes.
right? And if the liver function test is high,
Exactly.
then Jesus, what do you?
Yeah, we do a hepatic levels.
Yeah, you do and sonogram.
Abdominal sonogram.
Right. So if the patient has abnormal blood tests, the next thing is a sonogram to see if they have fatty liver. What else do we have? We probably do have neuropathy, correct? Where the nerves are damaged because of poor circulation. Let's see if we have a picture on poor circulation here. So when the patients come with neuropathy, Jesus, what are the symptoms they complain about?
Pain
Pain in
lower
the
extremities, swelling,
numbness,
Numbness,
tingling sensation. The pain
like
sometimes,
needles.
needles,
The-
pins and
Pins,
needles
yes.
they call it. And sometimes they might have even ulceration because of no sensation.
Exactly.
So they could have an ulcer and don't know they
they don't
have
know
it. So we always recommend that the patients examine their feet every night before they go to bed.
yes,
Also, poor circulation. The diabetes can affect the blood vessels, and therefore the blood vessel become clogged,
Necrotic.
and then the blood doesn't flow to the legs. The patients can have ulcer, redness, pain when they walk, right, Jesus?
Yes.
They come and they tell you that when they walk they have pain, and then we have to do a particular test. What do we do?
called an ankle brachial index, which is an ABI.
ABI, ankle brachial index. And we're going to do a test right now. All right, you're going to sit down, take your shoes off. So we mentioned the ABI study, which should be done to rule out peripheral vascular disease or poor circulation. Diabetics have high incidence of poor circulation. As a result of that, they lose their feet or their leg or a toe. It's get amputated because no circulation. So Jesus is going to perform. Maybe we should recline you. Or, okay. So in the ankle brachial index study, we're going to be checking the flow in the leg versus the pressure in the leg and the pressure in the upper extremity. All right, Jesus. So what are you doing?
We're going to go ahead and start under lower extremities on this patient to check for how good is the circulation.
All right, so he's going to try and find the pulse. If he has a good pulse, it means that there is good circulation, okay? So we're looking for the pulse. Okay, and Carlos doesn't have diabetes, so he should have good circulation. Okay, so we found it. It sounds good. Now you're going to take the pressure there, right? You're going to stop the flow. So we're getting the pressure. Excellent. So it's about 140. And then we usually do 2 legs, but in the interest of time, we're going to go to the upper extremity. Okay? So we're going to check the upper extremity. And usually what we do, we're going to compare the pressure in the leg with that in the upper extremity. The normal value is about 0.9 to 1. So let's go. All right, Jesus. So when he finds the pulse, he's going to take the pressure. Beautiful. He has great flow. All right, let's take the pressure. So it's about, it's about the same, about 150 or so. So the normal value here would be about a 1. That is normal. If the value is less than 9, that could indicate poor circulation, and another study must be done. Thank you, guys. We're going to take a short break. We'll be right back with more on defeating diabetes and its complications. So one of the complications of diabetes that we need to defeat is diabetic neuropathy. The best way to defeat that complication is to keep the sugar controlled. However, if you have the disease, there are different things we can do. We will give you medications such as seizure medication to help with the pain and the burning and the numbness, right, Jesus? But there's something you can do at home. We call this contrasting bath, where we place 2 containers of water in front of you right there. One is warm and the other one is cold with ice. It's an ice bath. So therefore, the warm one should be at a temperature of about 102 to 104. You start there first. You put both legs. Go ahead, Carlos. Put your both legs there. You're going to maintain this for about 3 minutes. Keep the feet there for 3 minutes. The contrasting bath is going to help with pain and numbness, swelling and inflammation, and even with circulation. So the warm water is going to dilate the blood vessels so you get more blood to your feet. And then after 3 minutes, you move the legs, put them over here, Carlos. In the interest of time, we're going to cut that. Then in the cold bath, the feet are kept for about 30 seconds to a
36
minute. Yes. So while they're in the cold water, what happens is that the vessel will contract, right?
Yes.
So close the circulation. So we have open and close. Now, patients that have ulcers or very poor circulation, we should not do the contrasting bath. Because when we put them in the cold water, then the circulation will be decreased.
Yes.
So guys at home, this is a good way to assist you with the pain and numbness. And if you have arthritis, this is also good for arthritis actually.
Yes.
And for swelling. So this is a really good home remedy that we're asking you to do. Don't go away, we'll be right back with more on defeating diabetes and its complications.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935.
Welcome back to Get Health with Dr. Cooper. Today we're discussing defeating diabetes and its complications. How do we do so? Well, guys, we're going to use food, correct?
Yes.
So in this segment, we're going to talk about food, right? A lot of patients don't know what to have for breakfast, for example.
Exactly.
And a lot of times they might do some green juice, green smoothie. Oatmeal is fantastic for diabetes because not only that it will keep the sugar low,
Exactly.
but also the cholesterol. Do you know that high fiber diet will help to lower the cholesterol?
Yes.
That's right. And a high fiber diet will also help to lower the blood sugar.
The sugar, yes, the blood sugar.
Yeah, the fiber of the diet will keep the patients feeling fuller longer, and not only that, will decrease the rise in blood sugar.
Exactly.
So we are going to do some green smoothie. Do you make green smoothie?
Yeah, well, not every day, but yes.
Sometimes. What about you? So,
Sometimes.
Alrighty, we're going to use some green vegetables here. All right. So we have some cut already. So let's start. I'm going to start with the cabbage. Cabbage is really good for diabetics. This is, we call this the free foods, because with the cabbage, there's absolutely no sugar here. So this is going to be fantastic. No calories. Let's try. Okay, let me get some more here, guys. All right, let's do the apple. Very nice. Apple. Let's try the kale. All right, so this is some green juice that I just made. It looks delicious, right?
Yes, it is.
And this is filled with a lot of antioxidant, a lot of
Vitamins.
like the beta carotenoid,
Oh, yes.
a lot of good, nice nutrients. All right, so many people will drink the juice. Now, what do we have here? Let me open this. Okay, let's see. All right, Carlos, what is this? What's this? This is the fiber, right?
The fiber, yes.
What do you do with this part of it?
You consume it.
Well,
What do you do with it?
To be honest, I just throw it.
Okay, and you consume it, right?
Yes.
All right. This must be eaten. We need to consume the fiber because, as I mentioned before, fiber is essential to lower the sugar, to keep the sugar stable and prevent that rise in the sugar.
Yes.
All right? Fiber keeps us fuller longer. So a lot of times when you drink this juice, you get hungry because you're missing the fiber. So I always use the fiber. We could use the fiber to make muffins. Yes. Cakes. Healthy cakes. We can also use this to make protein balls. So this is essential for health. Now, when we talk about diabetes or any disease, we need to focus on the meals. Right here, I have a balanced meal. We have to talk about balance. And what we mean by balance is this. For example, I have this in 4 quarters. 1 quarter should be the carbohydrates. That could be brown rice, whole wheat bread. It could be sweet potato. Another quarter should be the protein.
The protein, exactly.
Right? And for me here, I have garbanzo, chickpea.
Oh, it's
this is
delicious.
really delicious.
Yes, it is.
A lot of fiber, a lot of protein. And then, of course, we should have half of the plate with vegetables.
Veggies.
So we have some raw vegetable here and some steamed vegetable. This is how a balanced plate should look.
Should be.
If the patient does not consume a balanced plate, then what happens? The patient's going to get overweight. Many people in the United States think you should have a lot of protein, correct? And no carb,
And
but
no
that
carb.
is not balanced.
Exactly.
All right? So this is one of the ways we can defeat diabetes. And of course, exercise is essential. Hi, I'm Dr. Cooper Dockery. Did you know that prevention of diseases is the gold standard to keeping you healthy? But early detection is also vital. So why don't you call your doctor today for an evaluation? Today you've learned much about diabetes. We have looked at the complications of diabetes and how you can defeat diabetes. You might ask, can I really defeat diabetes? Absolutely. I mentioned about one patient who in 2 weeks got off his insulin, just changing his diet. Now, there's so many resources out there for you to help you become empowered in how to reverse diabetes. For example, my book, 14 Days to Amazing Health. In this, I have information on how to change your pantry, what food are healthy, what food should diabetes be consuming. I have exercise program here. I have information on meditation. So if you need more information, then just go to my website. But most importantly, take heart. There is hope. God is willing to help you. He is available. He said in Jeremiah 29:11 that he thinks good thought of us, thoughts to give us hope and a future. So take hope, because you can do it. If you have diabetes and you're on a lot of medication, it's not the end of the world. There is always hope. For more information, please follow us on Facebook, follow us on this same channel, and you'll have more information every week on how to use simple lifestyle choices to prevent, improve, or reverse chronic diseases.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website www.cooperwellnesscenter.com.